Okay, so hi everybody. I'm Britt. I'm a nurse practitioner and I work at a children's hospital in Cincinnati, Ohio. And I've been a nurse for 8 years and I've been a nurse practitioner for 4 years.
Wow. Can you explain what you actually do, what that means?
Yeah, so a nurse practitioner is one step below a doctor and one step above a nurse. So we're considered a mid-level provider. So some of my responsibilities are I intubate people. I do procedures. So intubation is one of them, and that's putting a breathing tube if somebody needs it in their mouth. Another thing that I do is we do lumbar punctures. So when we need spinal fluid from inside of your spine, we go in and with a small needle, we take that out, and I do that too. I start all kinds of lines like IVs and PIC lines and umbilical lines. I also I order things for the nurses to do. So if a nurse needs to feed a baby, I order that. So she does that on time and does all that things. I also assess all of my infants and make sure that they're healthy and everything's going okay. And if something is going wrong, then we order things to help make them better.
Okay. Um, so let's backtrack a little bit. What were your favorite subjects in school when you were a kid?
Yeah. So my favorite subjects in school were English. I loved writing. And science. I really thought the human body was the coolest thing ever. Like looking at all of the layers, like the muscles and the tissues, was really fascinating to me.
Wow. Okay. What kind of school did you have to complete after high school to get to where you are now?
Yeah. So after high school, I became a nurse, and that took 4 years of college. So I got my bachelor's of science in nursing, which means 4 years. You can get a 2 year degree. But a lot of the hospitals are phasing that out and they're preferring the 4 year degree. So if you have a 2 year degree, the hospitals will pay for your 4 year degree for you to finish that. And
Wow.
then to get my nurse practitioner, I went through another 2 years of schooling and a lot of clinical hours. So for both of those things, I did clinical hours where you're actually interacting with patients and figuring things out and on the job training. And now I'm currently in school getting another degree. So the degrees that I've got, so my first one was an RN. My second one was a PNP acute care, so a
Mhm.
pediatric nurse practitioner. And then my third one that I'm getting now is a neonatal nurse practitioner, which just means that I can take care of babies under the age of a year.
Wow. Okay. So
Yeah.
does the hospital pay for a lot of that schooling once you got the
They
job
can
there?
they can. So they paid for probably 70% of my first master's degree, and then my second master's, I don't work enough of an FTE. So I only work 1 day a week. So if you work three
Mhm.
days a week, they'll pay for the 70%. But because I only work for 1 day a week, they're not paying for the second. But yes, they will pay for your degree if you're working for them.
Wow. That's really interesting. So what is your favorite part of your job right now?
Oh, I have a lot of favorite parts of my job because I really love my job. But I think my absolute favorite part is when there's two. So one is when the babies get better and they get to go home. And that's a really cool thing because we all line up in the hallway and we cheer them on as they walk out. And then the other one is when a mom just has a baby and they have to come to me because there's something going on, but I get to dry them off and make sure they're okay. And then I get to hand them back to mom. And that moment where I get to hand the baby back to mom is really cool.
Wow. That's impressive. Okay. What do you wish you had learned in school that would help you now, like back in high school?
Ooh, there's a lot of things. I think that like high school education is so important and it's tailored to so you can live life, but it wasn't really tailored to my profession per se. And I wish that I would have taken the initiative to take more like science classes and like know more about like pathophysiology or anatomy and kind of dive deeper into that.
Mhm.
But I think I think those classes are offered. I just wasn't aware that they were offered, that I could do more of those things.
Okay. Okay. Um, what's the most unexpected part of your career?
I would actually say how much I love it because I didn't really know what the heck I wanted to do. when I was in high school, and I was just like, nursing, I guess I'll sign up for that. That sounds like it's cool. And I actually really, really, really enjoy my career path.
That's awesome. Um, so what's the hardest part of your career?
The hardest part of my career is how emotional it can be. Because sometimes there's just things that you can't control that happen, and you kind of just got to roll with it and love people through that. So it's reaching them on an emotional level and trying to heal them, and realizing when you can't, and letting a parent figure that out for themselves, but giving them the space to do that.
Okay. If someone told you they wanted to do what you do, what advice would you have for them?
Oh, I think that the advice that I would have is make sure you really love it, because it's very people-y. And what I mean by that is you're dealing with people all the time, and you're dealing with them in a situation that's very stressful. So sometimes you're not always met with the nicest personalities. Sometimes they're upset when they're coming to you because there's something going on with their children, and that's scary. And when people are scared, they act not their normal selves. So I think if you can just be understanding about that, and maybe not react to them, but kind of try to understand where they're coming from, I think that would be really helpful.
That is really great advice, actually. That's awesome. Um, so if there's anything I've missed or anything you'd particularly want to talk about it, is there anything like that?
Yeah, let's talk about what, like, pediatrics in general.
Mm-hmm.
So my pediatric nurse practitioner means that I can take care of anybody from the age of 0 to the age of 21. So once they're 21, they go to an adult doctor. And in the hospital, that's really cool because you can take care of them in any setting. So you can be in the ICU, where I am. So I work in the neonatal intensive care unit. So I'm working with really small babies that are sometimes no more than a pound. And then you can work up to high school teenage kids as well. And there's a lot of areas in the hospital that aren't as intense of a situation that I am currently in. I like this environment, but some people need a little bit more chill, and there's just so many options for that.
Mm-hmm.
So it's not just a one like hole that you're like training for, but there's a lot of things you can do with the pediatric nurse practitioner degree.
Wow. What are some other examples of that?
Yeah, so you can work in hematology and oncology. So you can work with cancer patients or people that have blood disorders. You can work in the general clinic. So you can just work with kids that are coming in to get physicals and things like that. You can work with kids that have learning disabilities. You can work with kids that need some rehab because they maybe were in an accident and they need help being able to walk and stuff again like that, walk and talk. There's so many. Is there any like environment in particular that you might be interested in talking about?
What about the general clinic?
The general peds.
Yeah.
Yeah. So in a general pediatric clinic, the kids you would call us and you'd schedule an appointment and you'd come in and we'd take your weight and see how tall you were and ask you how you're doing, ask you if anything's going on. We would do a general exam. If you have anything that you need addressed, like anxiety or like maybe your belly's been hurting, then we'll take care of those things. And we try to work as a team to come up with a plan to make you better. And if you're well, then we're just making sure that you're well, checking your heart, checking your lungs, making sure all of those things are healthy.
Well, that sounds really awesome. Wow.
Yeah.
You just get a little bit of everything in that one.
We sure do.
Wow. Is there anything specifically that you wanted to talk about besides what you already have?
I don't know. What do you think?
I don't know. My mouth is not working today for some reason. So it's
You're okay.
a whole thing.
It's all good. So I hope that kids understand that the job can be difficult, but it's also really cool. And you get to do really cool things and they're fun And it's really cool to see that you made a difference in somebody's life, that you made it better.
That's brilliant, Britt. It's really
Yeah.
awesome. Can't wait to show this to the kids. So that's going to be awesome.
I'm excited for them to see it.
Yeah. Thank you for talking to me.
You're
And
welcome.
I'll sign off the official call here.